Action.
Hi, Miss Shay. My name is Roseline. I'm going to be your nurse today. How are you feeling?
I'm good.
Can you please state your name and your date of birth for me?
Oluwaseyi Akindele, 11/08/2006.
Good, I have the right patient. Miss Shay, is it all right if I go ahead and check your vital signs?
Yes.
At this stage, I'm going to check for blood pressure, temperature, respiration, pulse, and oxygen saturation. I'm going to ask you a few questions if you don't mind. What brought you here today?
I'm here for my physical assessment.
Who is the president of this country?
Joe Biden.
Are you in any kind of pain or anything?
No.
Do you have any religious or cultural preferences that I need to be aware of?
No.
Okay, I'm going to check your, start with my assessment. I'm going to start from your head. Everything looks okay. There's no any abnormalities. I'm going to check for your pupil. Can you just look straight? Good. Everything looks okay. Can you tilt your head to the side? Good. I need you to tilt a little bit to the back while I assess your nose. Miss Shay, can you open your mouth for me, please? Say ha. Good. Everything looks good. Miss Shay, the next thing I'm going to check for is your temperature in your hand. Everything looks okay. I'm going to check for skin toggle to make sure you are not in you don't have any dehydration. Good. Next thing I'm going to do is squeeze my hand. Good. I'm going to check for capillary refill. Everything looks okay. The next thing I'm going to do is listen to your lung sound. The first sound is going to be above the clavicle. Take a deep breath in, out. Good. The second sound is going to be below the clavicle. The third sound is going to be just center around the breast area. Good. The fourth sound is going to be right below the breast area. And the fifth sound is going to be just right beside. Good. I'm going to check the posterior side. Take a deep breath in, out. Good. In, out. Good. The third sound is going to be just right at the center of the scapula. And the fourth sound is going to be right below the scapulae. The fifth sound is going to be right beside. I did not see any abnormalities. Everything looks good. Miss Shay, we are going to listen to your apical pulse, which is the most accurate pulse in your body. Can you lie down on the bed for me, please, if you don't mind? Thank you. And I'm going to listen for just 4 minutes. Take a deep breath in and out. Then I'm going to listen to it through the bell side for 1 full minute. Yeah, everything looks okay. I'm going to assess your abdomen. If you don't mind, I'm just going to raise up your blood a little bit. Everything looks okay. There's no any abnormalities. I'm going to check for bowel sound. I'm going to listen to the sound 5 full minutes on each quadrant. I did not see any abnormalities. Everything looks good. Then I'm going to palpate for any pain. Do you feel any pain? Do you feel any pain? Do you feel any pain? You can sit up if you want to. Are you feeling dizzy?
No.
Okay. I'm going to ask you some personal questions if you don't mind. When was the last time you had a bowel movement? Yesterday. How will you describe your bowel movement? Was it running or firm? Firm. What color was it?
Brown.
Good. Can you tell me the last time you urinated?
This morning.
This morning. What color was it?
Yellow.
Yellow. Was it a lot or just moderate amount?
Just amount.
Okay. Next thing I'm going to do is go down towards your leg and assess. Okay, can you put your leg on this here for me? Good. Miss Sherry, right now I'm going to palpate to check your temperature, if you don't mind. Alright, be loading. I'm going to check for edema. No edema. I'm going to check for tibialis, posterior tibialis pulse. Everything looks good. The next thing I'm going to do is check your feet. Do you feel me touching your feet? Good. Anything else or concern you have for me, Miss Shay?
No.
I'm going to document my findings and I will let the provider know. Thank you for your assistance.
Thank you.
Okay.